Hello, everyone. We'll give it a second before we get started so we can get everyone in from the waiting room. All right. Well, thank you for joining us today for our media availability. Today, we're going to talk about testing, a topic that I know you all enjoy asking questions about, and I hope that this will be helpful to you. We will go ahead and start with the presentation and then end with our Q&A. So please hold your questions until the end. And participating today, we have, Participating today, we have Dr. Eric France, Chief Medical Officer for CDPHE, Dr. Emily Travanti, Interim Director, State Public Health Laboratory, CDPHE, and Sarah Thunberg, Special COVID Advisor for CDPHE. And then my name is Heidi Bosk. I will be your moderator for today. And we're going to go ahead and start with Dr. France.
Thanks, Heidi, and good morning, everybody. Thank you for being here. It's an important topic, and we believe that taking the time to do a bit of a testing 101 with all of you will help you do the good work that you're doing to inform our citizens and state about all the efforts to better manage our COVID pandemic. Testing for COVID-19, of course, is one of the bedrock components, but it's important to recognize it's not the sole component, nor should we expect that testing can solve everything. So that'll be certainly one of the big themes you'll hear today. The second big theme, I think, is that testing is a little more complicated than it might seem. And certainly there are different kinds of tests that make it complicated. But the facts of testing and how they operate drive their own level of complexity. I think I'll start by just reminding us all that there's an aspect of testing that seems rather straightforward. Either I'm not feeling well or I've been exposed and I go to a testing site and I get tested. And in our mind, we're saying, okay, there's really two results. I'll either be positive, and then we'll need to isolate at home or see my doctor if I'm not doing well, or I will be negative and I can go about my day. I can go visit my mother-in-law at her home or my dad with diabetes. And so the challenge with testing, of course, is that it's not just two potential results, positive or negative. Tests actually always give us four different results. Four results that can be a true positive, which is when I have the disease and I test positive. A true negative, when I don't have the disease and I test negative. A false positive, where the test says I have the disease, but I don't really have it. Or a false negative, when I test negative, but I actually have the disease. So remember that there aren't two results in a test. There are potentially four different results. And of course, the goal with our tests is to make tests that are as accurate as possible, and as such, reduce the number of false positives and false negatives. Very few tests are perfect, and as we'll talk about today, the COVID tests are not perfect. And so they run this risk, even though they may be small, of producing results that are not accurate. Imagine for a moment you're an 80-year-old and you live in a nursing home and you get tested, and the test says you're positive for COVID. but it's actually a false positive. You don't actually have COVID. However, the staff with that positive result move you into a COVID wing, and now you're being exposed potentially, or at least at higher risk for exposure to COVID. So there's potential harm with a false positive. And to think about the 60-year-old child of that nursing home resident who goes out and gets tested and unfortunately has a false negative. Tests negative when they actually have the disease. They feel like they're ready to go and they go visit their mother in the nursing home where they may potentially spread their COVID. So there are real ramifications from false negative tests as well as false positive tests. So those have to be considered as well. And all this means that the conversations are more nuanced than the simple yes, no, positive, negative when it comes to test results. Today in Colorado, let's estimate that 1 in every 400 citizens is walking around with COVID. That means if I have a group of 2,000 people that I test, I would expect 5 of them to have COVID and 1,995 not to have COVID. If I have, let's say, 80% of the time I get a positive result when someone has the disease, that means if I test 2,000, 4 of the 5 who have COVID will test positive and 1 will be testing falsely negative. So 1 of the 1,996 negatives is actually a false negative. It seems like a small number, but when you then ramp up the amount of testing we're doing to thousands and thousands a day and tens of thousands a week, then the false negatives may be important. And so those are some of the challenges that we have with testing. Testing isn't just a simple binary 2 response approach of positive and negative, but actually give you these 4 different results. So because of this, it does mean my second theme today is for you all to remember that testing isn't the be all and end all. We really need to focus on what we know works. We need to emphasize the importance of social distancing, hand washing, wearing a mask, avoiding gatherings, so that we don't have to depend solely on testing results for the way that we manage things. So next slide. Of course, if you're having symptoms, we want you to be tested. This is also a bit of a change. If you imagine for a moment a year ago, you wake up in the morning with a runny nose and a headache, and you're thinking, well, I've got the cold, I've got the flu, I feel strong enough to go to work today, I'm going to go ahead in. And maybe after a couple, 3 days, you're feeling better. You don't go to the doctor's office. You don't go for any specific testing. We need to change our culture right now in Colorado. We need to all step up and take on the accountability and maybe the moral requirement of being tested if we have symptoms. So I wake up this morning, I have a runny nose, a cough, I'm not feeling well. Normally I would just maybe go on to work. Instead, I need to stay at home and I need to go to a testing site. And I need to make that effort to go to the testing site, even if I'm not feeling that sick. So certainly these are some of the standard symptoms for which someone might have an upper respiratory infection that could be COVID. And it's our duty in Colorado for each of us to go out and be tested if we have these symptoms. Next slide. Then there's the case of having been exposed. I had a family member who went to a park over the summer and had dinner with a friend. His friend called the next day to say that she no longer could taste food and ultimately tested positive. This family member quarantined for 14 days and on day 7 went in to get tested, never developing symptoms during that time. It is important that if you've been exposed to somebody with COVID-19, you get tested 7 days after that exposure and that you quarantine for a full 14 days while you wait for your test results and see if you've developed symptoms. And of course, even if you do test negative, our expectation is that you stay home and quarantine for the full 14 days. Next slide.
Wonderful. Thank you, Dr. France. And now, Dr. Emily Travanti, if you would like to take us through the tests.
Good morning. Today I'm going to talk to you a little bit about the different types of tests that are available for COVID-19. The first type of testing is the one that perhaps everyone is most familiar with. It's the first type of testing that was available at the start of this pandemic, and it still remains the gold standard test to this day. This would be molecular-based testing. The majority of molecular-based tests are PCR tests. There are some rapid molecular tests that are not PCR, but the PCR test is the gold standard of the molecular tests. This test is performed on a patient sample that is collected either by a medical professional or by someone who's trained to collect the sample. And there are also some that are now available that can be collected by self-collection. And these tests come with instructions for collecting a nasal sample or a saliva sample or a nasal swab sample. All of these PCR-based tests performed in the laboratory, so they have to be shipped to the site or transported to the site of testing, usually a large laboratory like the State Public Health Laboratory or a commercial or clinical laboratory such as a hospital lab. These tests detect the genetic material that's found in the virus, so COVID-19 or SARS-CoV-2, as we like to call it in the laboratory, is a RNA virus. It has an RNA genome that is encapsulated inside of a protein coat, and the test here, the sample is collected, and then when it gets to the laboratory, it is processed through an extraction and detection two-step system in which the first step or extraction is the genetic material for the virus is pulled out of the patient sample, and then the detection step involves an amplification. The PCR test is extremely sensitive and extremely specific, which is why it is a gold standard test, because it involves that amplification step, so it can detect very low amounts of the virus present in a patient sample, so it has a low limit of detection. And it is sequence specific, so it's designed for that amplification step to be specific for COVID-19 or SARS-CoV-2 and not any other seasonal coronavirus. This test is useful when you're symptomatic, but can also pick up patients who are infected with SARS-CoV-2 prior to showing symptoms or at the time of symptom resolution. Next slide, please. The second type of test that's available now and is becoming more widely available is the antigenic test. And this test is done more in a point of care setting generally, in more of a patient local setting, so very close to the patient, and can be done very quickly. Within 15 minutes to an hour, you can get a result off of an antigenic test. These tests are recommended for use within the first 7 days of symptom onset and are most effective when someone is symptomatic and showing symptoms of COVID-19. These tests detect the protein fragments that are part of the virus that causes COVID-19, and they are very similar to the rapid flu tests that you may be familiar with, and function similar almost to a pregnancy test where you get a line change between a negative and a positive on a card. They're quick, they are inexpensive, and they can be done frequently. And if you have a positive test on an antigen test, you are considered a positive COVID-19 case. These tests are performed also on nasal swab samples or saliva samples. Next slide, please. The final type of test that is available for COVID-19 is a serological test. And this test looks for evidence that you have been exposed to COVID-19. It does not tell you if you currently have COVID-19. It just tells you if your immune system has had a chance to interact with the virus at some point. These tests are a blood test. They tell you yes or no whether or not you have had potential exposure, and they can be performed either in an office setting or in a laboratory setting, and can be useful to let you know what's happening within a community, but it doesn't tell you if you are susceptible to the virus or if you're currently infected with the virus. It just tells you if you have been exposed at some point in the past. And as this pandemic is progressing, we're getting more and more information about how long someone remains positive for this, and we're seeing that it's highly variable and it can go away over time. So as all of the tests, they are a snapshot. They tell you what's happening at that moment, at the time that the sample was collected. So if you have a positive PCR test, you know that you had COVID-19 at the time that that sample was collected. If you have a negative test, it means you didn't have it at that moment of collection. However, if you get your nasal swab taken and then go out and spend the evening, with friends, you may be exposed at that point and then get your result back the next day and it was negative, but that doesn't mean that you weren't exposed in the interim. So we really want people to be mindful that all of these types of tests are a snapshot of what's happening at that moment of sample collection. And even the antibody test, the serological test, does not mean that you will always have antibody to COVID-19. It just means that you had the antibody at the time that the sample was collected. Next slide.
Great, thank you. And now we'll pass it over to Sarah.
Thanks so much. So one of the things we do a lot of at CDPHE is push out data related to COVID-19 and what's happening across Colorado in our communities. And one of the key visualizations of some very important data is shown here. And this chart shows the number of tests completed each day, both in private clinical laboratories as well as our state public health lab and labs that we send samples to. Those are the green and brownish lines. And then the red line is the percent positivity, in this case, a rolling 7-day average. And this percent positivity line is super important, so I wanted to take some time to talk about it today. Percent positivity is the calculation of all the tests that were done in a certain period, what percentage of them were positive. And the guidance from the World Health Organization and the Centers for Disease Control is very clear that we want to have our percent positivity over either a rolling 3 or 7-day average be at or below 5%, which means for every 100 tests we do in Colorado, we want no more than 5 of them to come back positive. This is super important because it can tell us 2 really important things. It can tell us, it's the measure of if we are testing enough to be able to pick up disease as it is spreading through our community. So early in the days on the left side of this chart, you can see that there was more than 20% positivity. And that's an indication, as you can see in the chart, that we just didn't have enough testing. All of us can probably remember those days where it was just impossible to get tested. So we didn't really know how much disease was being transmitted in our communities. But you can see on the right side of the graph that as our percent positivity has increased, so has our amount of testing. And when we look at our case counts each day, we also want to see that the number of tests performed each day goes higher and higher and higher. It's important because we want to know where there are clusters of disease, where we see widespread community transmission, and we can't do that if we don't have enough testing. So instead of selecting a single value for how much testing we want to do each day, we want to ensure that we can sort of rise and flow with that percent positivity calculation. Super important. Next slide, please. This is another visualization of the same thing I was just talking about, which is the number of laboratory tests, or those molecular tests that Dr. Travanti was talking about, aligned with our percent positivity. So we want to see those things rise and fall together. And you can see that we have increased our testing capacity enormously over the course of the COVID pandemic. Next slide, please. we want to encourage everybody who is symptomatic and everybody who thinks that they need a test to get a COVID test. And as we just talked about, testing in the state of Colorado is far more accessible, and we have a bunch of free, easy test sites to go to. We're working really hard on building robust maps that show people where they can get a test. So shown on the site is a location where you can find some of the 50 community-based test sites across the state. I also would say that there is great information about test sites in Google Maps, the glory of a private company that can do, that can sort of scan the whole of the internet, is they can have a faster, more robust test site map sometimes. So we love if people come to the covid19.colorado.gov site to get the best source of Colorado information. But also if you're looking for a test site near you, searching COVID-19 test near me in the Google map is always a good choice too. Next slide, please.
Great, thank you. And now we'll close out with Dr. France.
Thank you. So just to conclude then, certainly testing is an important component, but it's really just one component of our strategy. As I emphasized earlier, we need to continue with the message that to best control and reduce our COVID pandemic, we need to avoid large gatherings, stay home when we're sick, keep physical distance, wear a mask, and washing our hands frequently. If you're feeling sick, we need to encourage people the new habit of having a very low bar for going in to get tested. We all want to be tested frequently if we're sick or if we're exposed. So thank you for your time, and I think we're ready to take questions.
Yes, so now we're at our question and answer portion of the presentation. If you have any questions that are on a different topic or maybe a little bit more in depth, please feel free to email those to media_info@state.co.us. And then if you do have a question, please use the raise hand function and I will call on you, unmute you, and if you could say who you are and which outlet you're with, that would be really helpful. Yes, John, I'm going to start with you.
Hi, everyone. It's John Engold from the Colorado Sun. I have a question for Dr. Sravanti. I'm wondering if you are seeing, or I know last time when we spoke, you hadn't started seeing a lot of the Abbott tests coming into circulation in the state, and I'm wondering if you're seeing more of them now, and then as more of them come online, how does that end up impacting the interpretation of the positivity percentage, given that those tests can have relatively higher false negatives?
Sure. So we are just starting to see the Abbott Binax test coming into Colorado. Some of the other antigen tests have also been coming in as well. Many are going directly into our long-term care facilities. And we expect to see these moving out into more expanded use over time. All of these test results are reportable to the state, positive and negative, from any facility that's performing them, whether it's a medical clinic or a long-term care facility. And the state also is able to track what type of test was performed. So we will be able to look at the data over time to know if we're looking at PCR tests or antigen tests or just tests overall, so that we will be able to see that overall positives, because a positive on an antigen is a positive case. But we'll also be able to look into the data a little bit and know if we're looking at a PCR test result or an antigen test result, which will help us as these tests, which are, they're new. Many of them are, well, all of them are operating under emergency use authorization from the FDA, and their use in a clinical setting will allow us to get expanded information about their sensitivity and their specificity over time, and inform that on a statewide level.
Okay, great, thanks.
Great, thank you. Anusha, you are next.
Hi, I'm Nisha with 9 News. Dr. Francie, you mentioned this a little bit, but with the case trends happening right now, what is the updated message to the public about how they should be conducting themselves going out in public, in addition to wearing masks and lowering the bar for testing? What should people be thinking about, and should they be changing their habits from the last couple of months based off of the number of positive cases we've been having?
Thanks for the question, Anusha. You know, the message is the same. It is the basics as we described of making sure we're keeping our distance, wearing our masks, washing our hands, avoiding mass gatherings, staying home if we're at higher risk for an event. I think my hope is that as people in the communities see rates in hospitalization go up, number of cases go up, we'll all be taking this more seriously and we'll be more vigilant about safe behaviors. I know that at CDPHE, we're, like you, watching the numbers closely, and there'll be decisions made in the future as needed if numbers keep going up and current strategies are not getting the levels of control required to reduce the risk.
Great, thank you. Next, we'll go to Seth.
Hi, doctors. Curious if you can talk about the combination flu COVID test. I know there have been challenges elsewhere associated with standing that program up for a long time because of lack of supplies, but I wonder where Colorado is at in that process. And I'm sorry, I'm with the Denver Gazette.
I can take this one. This is Emily Travanti at the State Lab. We at the State Laboratory are working to stand up the CDC version of the COVID-19 flu combination study, or assay. And we have been informed by our federal partners that we will have state-specific allocation of that test, but we don't have exact numbers on that at the moment. There are some commercial laboratories that are also bringing panel assays on that will look for a wide number of respiratory pathogens at the same time. And these will be available in some of our larger clinical hospital systems, as well as the large reference laboratories.
Thank you.
Great, Sonia, I'm going to take it over to you.
Hi, good morning. So I'm Sonia with 9 News, and I have a question about what people should expect coming up as far as rules with masks, social distancing, given the updated numbers with community spread. Should people expect more strict rules?
Yeah, Jarek, I would say that we're going to focus here on testing today, and there'll probably be more information coming.
Sorry, so should people not expect anything like that? Or at least this is not the space to ask that question. Is that what I'm hearing?
I think that's right.
Yeah, Sonia, we can follow up with you. I think I think in this space we're talking about testing, and also some of those general that we do encourage people to wear masks, social distance, all the wonderful things that Dr. France said. Do we have any other questions?
I think there's a question from Serena.
Yes, hi, can you hear me?
Yes, oh yes, we can.
Hi, so I don't know if this would be the right place to ask this question as well about companies or businesses that have 2 or more tests within a 2-week period. Can we ask this, or do you want this to be directed to you on the side?
Do you have a specific question in that space? I know that we are going to try and talk about outbreaks in another media availability, but if it's related to the test and the test type, I think that this is the space for that.
No, this is regarding a Costco over on 92nd and Harlan with multiple positive results, and wondering what are the guidelines for CDPHE to close the facility when there is an outbreak.
Oh, yes. So for an outbreak, we'll go ahead and respond to you. I believe that we did have a request that came in for that. So we'll respond to you out of the media info inbox on that one.
Gotcha. Thank you.
Yeah, thank you. Do we have any other questions about testing, test sites, test types? Wonderful. Well, as always, if you have any additional questions or questions on a different topic, please send those over to media_info@state.co.us. And then before I let you leave for your day, I'm wondering if Dr. France, Dr. Travanti, or Sarah have any final words of wisdom or things you would like to say about testing.
This is Sarah Thunberg. I would just love to say that testing is one of the key tools in our COVID containment strategy, but we encourage everybody in Colorado to do all of the other great, well-supported, evidence-based strategies. So wear a mask, stay 6 feet from people, avoid large gatherings, wash your hands, take all of those precautions. They are the easiest ones. And as we're seeing cases really increase, it's up to each one of us to do our part to avoid increasing transmission and the terrible outcomes that can come from getting COVID. So please, please, everybody, protect yourself, protect your family, and do those really basic things. That's the way we're going to get through this.
Well said, Sarah. I have nothing more to add. Thank you.
I agree. Thank you, everyone.
Great. Well, thank you all for joining us, and we hope you have a wonderful day, and we'll see you for our next media availability.